Okay, welcome everyone. My name is Jen Hansen, and I have the pleasure of hosting today's Gentle Movement at Home session with our instructor and friend and close collaborator, Neil Pearson. We're really excited to bring you here today to be able to do this. We had a great reception for this on our the first time we tried it, which was on Monday. And so we're just really thrilled to be able to continue this series, to connect with everyone online at home, and to be together today. So just a couple housekeeping pieces, I guess, before we start. Today's session is being recorded. It's also being broadcast live on our Facebook page. You don't need an account to join. You can just go there and see what we're doing. In a couple days, we're going to post the recording of this session to YouTube. So you can always go back and review it again if you're interested, or send it on to friends. We welcome anyone, and not just in BC, but across the country and across the world to these sessions. So please do share with your networks. We do have a poll at the end of this session, and we're just curious about what you think. If you could stay a few seconds longer and just complete the poll, we really appreciate it. If you have any questions for us or need help, just do email education@pnbc.ca, and you can do that during the podcast if you have any live technical questions, or you can also message us in the chat. I think, we'll talk about the upcoming sessions after this. We do have some upcoming sessions. Tomorrow, we've got one at 1 o'clock with physiotherapist Will Bateman. And then we've got a couple more the week following, and so I'll discuss those after. But right now, I think it's time to hand things over to Neil. So Neil, take it away. We look forward to a great session.
Great, thanks, Jen. And welcome everyone to the second of this series. We're going to do this practice today in a seated position again. So we will move on to some getting out of the chair in other sessions, but for now we're going to stay here. So if before we start, or anytime while we're doing the practice, if you need to say get up and move around, or remember you can stop anytime you want, pause anytime while we're doing this for whatever reason that you want to. So if you can, find a nice comfortable place to sit. If you can sit away from the back of the chair so your spine gets a little bit tall, and you let your shoulders relax a little bit, you can just start in that kind of position. If you want to, for now, you can let your eyes close, or you can soften your gaze, or you can stop looking at the screen and look at something else in the room, because I'm just going to be guiding you through a breath awareness practice as the start today. So what I'd like you to do to begin is to take your attention to the sensations of your breath. So just notice your breath. As you breathe in and as you breathe out, notice the sensations of your breath. Now, if you notice something about your breath that you want to change, it's okay to do that. As well, though, if you're all right with just noticing and just letting it be and not changing it, you can do that too. And that will sort of be the guidance that I give you for now, is make this more about awareness than about changing things. We'll get to changing our breath in just a little bit. So feel the sensation of the air as it goes in through your nostrils, and maybe you can feel it through your sinuses or the back of your throat, and then feel the sensations of the air as it comes back out again. Do your very best right now to focus your attention on those sensations. The sensation of the air as it moves in through your nose, sinus, throat, the sensation of the air as it moves back out. And your job is just to be a bit of an explorer, to notice whatever the sensations are. Then shift your attention now from the feeling of the air to the sound of your breath. So maybe you can actually hear your breath, or hear something about your breath as you breathe in and as you breathe out. This can be hard to do, and it depends a little bit around the noise that around you. You don't need to try to make a sound. Just see if you can hear anything about your breath. Then shift your attention again. This time, notice how long does it take to breathe in? And how long does it take to breathe out? Maybe it's different from breath to breath. Maybe there's a difference between inhale and exhale. Just check it out and see what's happening. And then you can look a little bit deeper and notice, is the pace of your breath, how fast your breath is moving, is it the same all the way through the inhale and all the way through the exhale? Or does it shift? Is it faster at the beginning, slower at the end? Is it different from inhale to exhale? So notice the pace of your breath. Then shift your attention again. This time, notice that little place between inhale and exhale, and that place between exhale and inhale. And notice how long you pause. Maybe the pause is really brief, or maybe it's longer. Just notice that pause. Now shift your attention a little bit further out to your body and notice how your body breathes as you breathe in and as you breathe out. Notice how your body moves. So maybe you can feel movement around your belly and your ribs and your chest. Once again, you don't need to change this. You can just notice if that feels all right. But of course, if you want to change something, if you feel it's important to do it, go ahead and do it. Just like changing your position, you can do that anytime you want. Then notice the movement of your body at the front of your body and the movement of your body at the back of your body. Just notice front and back movement. And notice the movement on the left side and the right side. Maybe it's the same both sides, maybe it's different. Just notice whatever it is. Then see if you can notice any shift or any movement or change in the rest of your body. So as you breathe in and as you breathe out, do you feel any movement in your neck or shoulders or legs or feet or hands or head? If you've ever seen a baby or watched a baby breathe, you get the idea here. Sometimes when you're watching a baby at rest breathing, you can see movement all the way from the crown of its head to the tip of its toes. So just notice, do you feel anything changing anywhere else in your body besides your torso as you breathe? And then take your attention to an area of your body where you have discomfort, tension, or pain. And notice if that changes while you breathe in, or if that changes while you breathe out. Now take your attention back to the feeling of the air as it comes in through your nostrils, the feeling of the air as it goes out your nostrils. And just keep your attention there for the next few breaths. So now we're going to get you to change a little bit. What I'd like you to do is to start to change your breath or regulate your breath. So now I'd like you to make your breath feel longer. So whatever length of breath you just had, just make your breath last a bit longer. You don't need to make it really long, just a little bit longer than it just was. A little bit longer on the inhale and a little bit longer on the exhale. And there's no need to make it longer and longer and longer. Just a little bit longer than it was a moment ago. And if you lose your breath at any time, just pause, catch your breath again, and come on back in. The idea right now is to savor your breath. Make your breath last just a bit longer, all the way through the inhale, and make it last just a bit longer through the exhale. Now, if you're okay with sticking with that, stick with it. Remember, you can pause anytime you want, shift around, move, it's all fine. If you're okay with longer, then what I'd like you to do is add another word. And the other word is to make your breath feel smoother. Now you can smooth out the feeling of your body moving as you breathe in and as you breathe out. you can smooth out the sensation of the air, the feeling of the air as it goes in and the feeling of the air as it goes out. There's lots of things about your breath you can smooth. So think about making your breath longer and smoother. Now, if you're doing okay with those words, stick with that. If you need to pause or shift, do that. If you can add one more word in, add in the word softer. Sometimes it's a harder one to get. But you know, like if a muscle was really tight in your body and you wanted to release it to make it feel softer, do that with your breath. Or maybe you've experienced a time when your mind is really gripping onto an idea and you wanted to let go of that. If you can do that there, see if you can make a little bit more softness in your breath as well. So each time you breathe in and each time you breathe out, you're thinking longer, smoother, softer. So stay with this breath if you can. And we're going to just get you to start to move your body. And as you move your body, what I'd like you to do are two things. One is to do your best to stay focused on being able to breathe in a longer and smoother, or a longer, smoother, softer way as you go. And the other thing is to just stay focused on your breath. So what I'd like you to do as you do these movements, or what I want you to work on while you do this, is to notice if your breath starts to change, if your breath starts to get tighter, or maybe you start to hold your breath, or maybe your breath starts to get faster. Just keep on coming back to this idea of longer, smoother, softer breath. And get yourself in that place where you can be aware if your breath is changing. As much as you're doing the movement, and as much as you're taking good care of your body while you're doing it, also pay attention to your breath. And this can take some work, some practice. So we're going to practice it for a while now. So longer, smoother, softer breath. Start by just moving your body. So you're going to move your body sort of in circles. So over top of your hips and your pelvis, and your hips and your pelvis will move a bit. But just circle your body around. And once you get the movement, come back to longer, smoother, softer breath. And you can move just a little bit while you do this, or you can move really far if that feels good. It's up to you. But you're trying to keep your breath longer, smoother, softer. Now, whichever direction you decide to go in, go back the other way, because it might be very different to go the other way. Remember, if you do nudge up into the pain, it's okay to just nudge it. Just don't push through it. Don't jam through it. This isn't about seeing how good you can put up with pain. Keep your breath longer, smoother, softer. And then come back to the center for a moment. Let your body pause for a moment. If you need to let go of that breath, let go of the breath, and we'll come back to it in a moment. If you need to move your body around, go ahead and move your body around. This time we're going to do circles with our shoulders. So come back to longer, smoother, softer breath. Lift your shoulders up towards your ears. And then for start, let's bring them forward. So bring them forward, pull them on back, and then up towards your ears again. Once again, you can do a small movement while you do this. So if you see the movement from the side, this is the movement. So you're keeping your breath longer, smoother, softer while you're doing this. And then try going the other way. So pause, keep your breath longer, smoother, softer. Circle your shoulders the other way. So you're doing your best to divide your attention between the movement. If there's any tension or discomfort and pain, noticing that so you don't just ignore it, push through it. And staying with the breath. So once your shoulders come down next time, just let them rest. Now we're going to do a gentle rotation with our neck. So again, be gentle with this. You need to divide your attention between your breath and the movements and any tension, discomfort, or pain. So start with just doing small circles. So just tilt your head to the side and let your head come on down. Circle it over towards the other side. And for a lot of us, it feels best not to go back too far, but to go straight on over towards the other side. If you know that your neck is perfectly fine going back, it's okay to do that. If you're not sure, then as you come up to the other side, you come to the side and then you go straight up to the other side of your shoulder and then down again. And then whichever way you decide to go, try going the other way now. So keep your breath longer, smoother, softer, while you gently circle your neck and head the opposite direction. If you've noticed that you've sunk down in your chair, then try to come up to get your spine a bit taller, because it's way easier to do easy movement of your neck, or to move with ease with your neck when you're in that longer spine position. So once you get around to the center again, just pause again. You can either stay with longer, smoother, softer breath, or you can let it go. Catch your breath again if you feel like you're losing it. And then come back to a little bit longer, a little bit smoother, a little bit softer than it was back in the beginning. As you continue with longer, smoother, softer breath, breathing that way, what I'd also like you to do is create a sensation that you're breathing, taking your breath actually into a part of your body. I'm guessing that as you sit there and you feel your breath longer, smoother, softer, you can feel your breath coming into your torso. And you can feel the breath sort of releasing and coming back out again. What I'd like you to do is create a sensation right now, as if you could feel your breath coming right out into your hands. So as if when you breathe in, you just don't feel like it's coming into your torso. It's like you feel your breath coming into your hands. So longer, smoother, softer breath. The sensation that the breath is making it all the way into your hands when you breathe in. And then when you breathe out, you're just letting it go longer, smoother, softer. So as you're doing that longer, smoother, softer breath and creating that sensation is coming into your hands, start to move your hands. So as you breathe in, feel that breath coming into your hands. Spread your fingers wide, thumbs wide, and as you breathe out, just let your hands relax again. Now I'm holding my arms up to do this so you can see it, but you can still have your hands down in your lap if that feels best. So it's longer, smoother, softer breath. Creating a sensation that the breath is coming into your hands as you spread your fingers and thumbs out. And then as you rest them again, let them relax as you breathe back out again. So breathe in, reach with your fingers and thumbs. Breathe out, let go. Using longer, smoother, softer breath and breathing into that part of your body. Now try to do the same thing in your forearms and your wrists. Create the sensation that when you breathe in, that you're breathing into your forearms and wrists. Longer, smoother, softer breath, creating that sensation. And then start to move your wrists. Let's start with circles. Just circle your wrists around like this. Whatever pace would feel best, whatever direction feels best. Keeping your breath as much as you can, longer, smoother, softer. Making sure you're just not pushing through pain. If there's pain or tension or discomfort in your wrist, don't push through it. Just sort of go to the edge and make the movement smaller if you need to. But creating that sensation as if your breath is coming right into your wrist while you do the movement. And then try the other way. And then let your wrists rest. Give a pause to the breath if that feels best, or stay with it if that feels best. Shift around if you need to. Remember, you don't need to wait for me if you need to do this. Now create a sensation that you're breathing into your upper arms and your elbows. The sensation as if the breath is coming into the front of your upper arms and elbows, the sides, the backs, all the areas. It's a longer, smoother, softer breath. Creating a sensation of the breath coming right into your upper arms and elbows. And then gently start to move your elbows. This time lift your arms up if you feel okay with it. You're feeling that sensation like you're breathing into your upper arms and elbows and just moving your elbows back and forth like this. If you want to bring them up here and reach out, go ahead and do that. If you want to have your arms resting down at your sides and bend your elbows this way, and you don't have to bend them all the way. But each time you breathe in, you're creating that sensation like your breath is coming into your upper arms and your elbows as you do this movement. And then let your hands and arms rest. If you feel like giving your shoulders or your body a shift around, go ahead and do it. Stay with the breath if you can, or let it go and pause for a bit before you come back. Then do the same thing with your shoulders. And this might feel a little bit easier to feel like you're breathing into your shoulders, like your breath is going there. And I know it can feel like a struggle when I say this, because I know your lungs are here, and you can't actually take your breath to those parts of your body. The idea is to create the sensation as if you were. So with longer, smoother, softer breath again, create a sensation as if you're moving your breath, breathing out into your shoulders, all through the fronts of them, tops and the backs around the shoulder blade. And now that you're creating that sensation of your breath coming in your shoulders, start by just lifting your shoulder blades straight up to the sky, up towards your ears, and then let them come on back again, down again. And just keep on with a longer, smoother, softer breath, creating a sensation like you're breathing into your shoulders and shoulder blades while you breathe in, while you lift your shoulders and then let them come on back down again. Remember, you can pause anytime you want. You can move a little bit or you can move a lot. And then if you can, stay with the longer, smoother, softer breath. Stay with that idea of breathing or creating that sensation in your shoulders. And this time work on rounding your shoulders forward and back. I'll show you this from the side. So you're still doing the longer, smoother, softer breath. Still creating that sensation as if you're breathing in your shoulders. And if you want to do it with a little bit more movement, you can lift your arms in front of you so your hands are together. And as you round your shoulders forward, you can reach your arms straight out. And when you bring your shoulder blades back, you can feel your arms coming back. If that would feel better, go ahead and do it that way. Now, if you try this and it doesn't feel like the right thing to do today, then just let your arms rest. Draw your shoulders forward, draw them back while you continue to feel that sensation of breathing into your shoulders and shoulder blades. And just stay with that longer, smoother, softer breath. And then let your shoulders relax. We'll try another shoulder movement. We'll just try lifting our arms up. So the movement will be this movement of taking your arms out towards the side. And if you want to, you can take them right up and let your palms touch and let your arms come down again. If the movement that's best for you is this kind of a movement up to here, if you say that's where the edge is, that's where it's enough, just go there and come on back down again. So once again, longer, smoother, softer breath. Start with a tall spine. Create that sensation that you're breathing into, around your shoulders and shoulder blades. And while you're doing that, lift your arms up, palms sort of facing towards the front, only as high as you want to go, and let them come on back down again. So if you start to feel like your breath is getting tight, what you're going to do is say, well, that's maybe far enough, or maybe what you decide is that I'm going to try harder to keep my breath longer and smoother and softer. Because sometimes you'll find as your breath gets tight, if you try harder to keep your breath calm, you can do that, and it starts to get easier to do the movement. Or other times you do it and you feel like, no, that's enough movement for right now. I can feel my breath getting tight. I want to just keep the longer, smoother, softer going without getting my breath getting really tight or really rapid and shallow. So next time those arms come on down, just let them rest again. Let go of the breath for just a moment. If you need to move around, go ahead and do it. We're going to do a little bit more movement with the spine. So this time what we're going to do is get you started with a tall spine. The movement we're going to do is rotating over towards the side. You're going to try to keep your head sort of level or in line with your chest rather than taking your head really far. For right now, keep your head in line with your body. You can put your hands on your thighs or one hand on the chair and the other one on this thigh. And the movement will just be rotation to wherever you feel is okay and then come on back to the center. Just going to do one side at a time. So now you got the movement idea. Pause for a moment, lengthen that spine a little bit. Come back to the longer, smoother, softer breath one more time. This time, create a sensation that your breath is coming right into your spine. It can be harder to do this because it's a big area, but see if you can create that sensation. Maybe it's like sensation of length in your spine as you breathe in, as if you're breathing in there. So longer, smoother, softer breath in around your spine while you do it, and start to do that movement just to one side to begin with. Doing your best to keep your spine tall, keeping the rest of your body from getting too tight. If you run into a spot where you feel like that's far enough, just go there. It's okay to go to the edge and just provoke the pain or tension just a bit. But what you don't want to feel is it's getting worse and worse the more you do. If that's happening, maybe it's enough for right now. It's best to pause, come back to the breath, find some more calmness in your breath and your body again. So let's try the other side now. So once again, that tall spine, longer, smoother, softer breath. Maintain that as best you can. Come around to a twist. As best as you can, keep your breath longer, smoother, softer. Keep your spine tall. Keep creating that sensation that you're breathing into the spine as you do this movement. Once you come back to the center again, pause again. Move things around if you want to, or stay still, whichever would feel better. Come back to longer, smoother, softer breath. Just stay with that for a moment. Focus on the breath. See if you can take all of your attention again and focus it on making your breath longer, on making your breath smoother, on making your breath softer. Remember, you don't have to make it more and more of any of these things. Just a little bit more than it was at the beginning. So now you've created that breath again. Once again, we're going to create the sensation that you're breathing into a part of your body. And this time, let's create the sensation that the breath is moving into your neck. So the longer, smoother, softer breath, creating the sensation that you're breathing into the areas of your neck, the front and the sides and the back and around the spine. Maybe it's easier to create that sensation of length in your spine while you do it, and that helps you feel your breath coming into that area of your body. And now move the neck. We'll start with the side bend. So as you breathe longer, smoother, softer, let's start with your head off towards your left shoulder. So just bring your head down towards the left, only to that just right spot, then come back up again. So as you're doing this, try to keep your spine tall in this kind of a place rather than here. I know it can be hard to get here first, but try to get a little bit of length in your spine while you do it, and do the movement from there. If you feel yourself collapsing down, then get a bit taller again. Longer, smoother, softer breath. Creating that sensation that your breath is coming into your neck, your ear coming down towards your shoulder, only to the just right spot, and come on back up again. And then try the same thing the other side. So you got the longer, smoother, softer breath. You're creating that sensation that you're breathing into your neck. And you're letting your ear come down to your shoulder, wherever feels like the right distance. Back up again. Now you can see the pace that I'm doing this, but you don't have to do it this pace. You can go more slowly if you want to. You can do it a little bit quicker if you want to. However you do it, just be mindful and be gentle while you're doing the movement. And then next time you come out back up to the center, let's pause there. Then we'll come back to rotation of the neck. So we've done rotation of the rest of the spine. Let's do the rotation of the neck. So be gentle with this. If you do run into a spot where your breath gets tight or your body starts to get tense or you're starting to feel like it's not a safe thing to do, just go to that spot and then come on back again. So you've got the longer, smoother, softer breath again. You've got that sensation of breathing into your neck. And start by just gently looking over your left shoulder while you maintain that breath, that sensation. Just go to that just right spot. Maybe it's a big stretch for you today, or maybe it's a small one. While you do this, keep your spine tall. Try not to slouch down while you do it. Head just sitting here for a long time, so those muscles might be getting tired. And if they are, take a break, take a pause, move around, lean against the back of the chair for a moment if that's the best thing to do. And then try the other side. Longer, smoother, softer breath, creating the sensation that you're breathing into your neck. Turn and look over top of your right shoulder. Just have to go to that just right spot where you feel like it's an okay amount of movement. That even if you do nudge into something, you know as you come back again, you have that sense that yes, I'll be all right. Of course, this is practice. So if you find that you do it a few times and you start to notice that the pain is increasing or it's getting harder to breathe calmly, then you'd say, okay, I'm not going to move that far right now. I'm just going to take it more easy. Remember, you can shift, you can modify. You don't have to just do the same thing every time. Part of this is become more discerning. So let your neck rest now. Let your breath go for a moment. So part of doing these movements with the breath like this is to start to become more aware of what's happening while we move. Because sometimes we just do the movement and we push. And what we're trying to get across here is that gentle movement and recovery of movement when we've got pain often takes being able to notice the different messages that the body is giving us. So sometimes the body tells us that's enough by giving us pain. And sometimes the body can say, hey, I think that's enough by making your breath get tight. Or it might do that by making your body get tight. Or it might do that by making it so it doesn't feel safe. You start to think, oh, this doesn't feel safe anymore. All of these things are different messages that say that your body is saying that's enough for right now. Now, we know that what we want to do is try to change this. We know that when pain persists, that those protection mechanisms often get much louder than they need to be. It's not that the protection mechanisms don't need to tell you anything, but often instead of telling you this much, they tell you this much. And so through this kind of movement, we learn how we can go up to that edge. And if we can keep our breath calmer, and if we can keep our body calm and our mind calmer while we do it, then a lot of times we can retrain the nervous system so that instead of yelling at us this loudly, it just says, hey, be careful here. And that lets us have more movement and less pain with movement. So that's part of where we're trying to get with this kind of practice. So again, if you need to shift around, go ahead and shift around. This time what we're going to do is take your breath down into your hips. So as you breathe longer, smoother, softer, create a sensation as if your breath is coming into your hips. Sometimes it can be hard to create that sensation of breath coming into your legs, but give it a try. As you do that, as you continue with that longer, smoother, softer breath and creating that sensation as if the breath is coming into your hips, you just start to move your legs a little bit from seated like you're doing walking or stepping upstairs. So you just lift one knee up and bring it back down. Next breath in, you lift the other knee up, bring it back down. So the whole time you're doing this, you're doing the longer, smoother, softer breath, creating the sensation that you're breathing into both hips, if you can. But for some of you, it may be way easier to, whatever hip you're about to move, create the sensation that you're breathing or your breath is going into that hip. And then next breath, shift over to the other side. You get the choice of whichever way you want to do it. And remember, don't ignore your body and don't ignore the pain. If there's signals saying that's enough, then pause. That's enough for now. It's okay. If you can, stay with the longer, smoother, softer breath and that sensation of the air or the breath going in your hips, keep on doing that. If you need a pause, have a pause. Shift the movement this time. So when you do the longer, smoother, softer breath, we're going to start by trying to lift your foot up as if you were going to lift your foot up and cross it on your other thigh. Now maybe your leg doesn't get up that far. If it doesn't, just bring your foot over towards your other thigh or your other calf. We'll slide it up and then slide it back down again. And then do the same thing on the other side. Now I'm guessing as you do this movement, you may have lost the breath. So now that you've got the movement, come back to your breath again. So see if you can come back to a longer, smoother, softer. Do that while you do the movement. one more time each leg, if that's all right with you, or if it's enough right now, just pause and wait. Great. And then let go of the breath again. Move your body around. And the one other thing I want you to do with this, just the next couple of things that we do, is also at the same time as you're noticing your breath, if you can, if you feel you can do one more thing, and I know I'm asking you to do lots of things, if you can, also notice what happens around your jaw and your face. Because sometimes when we do things, when we get up towards that sort of spot where it feels like it's getting too much or almost too much, sometimes we start to grip with our jaw or even push our tongue into our teeth, or we start to get tight around our forehead and our face. And just notice that, right, for now. And if you notice it and it's tight, see if you can make that a little bit softer too. So come back to a longer, smoother, softer breath. For a moment, create the sensation like you're breathing actually into your face. And see if this helps you relax the muscles around your eyebrows and your forehead, around your cheeks, your jaw, and your tongue and your lips. Now see if you can stay with all that and take your attention out to your knees now. Create a sensation that your breath is coming into your knees. Your breath is longer, smoother, softer. You've got that sensation of your breath coming into your knees. And you're going to move your legs. So this time you're going to bring your foot and heel off the ground, like you're bringing your foot back towards the chair. Now, if you aren't in the chair, that's okay. Just do it as far as you can and put your foot down. And then do the other side. Bend that knee so your foot comes up towards the chair or into the chair and back down again. So now that you've got the movement, come back to longer, smoother, softer if you lost that. Come back to that sensation of breathing into your knees or just the knee that's moving while you do it. If you can do one more thing while you do all the rest, notice what's happening around your face. Notice that softness, that relaxation of your face is starting to go away, or if you can maintain it. It's okay if you feel a bit of tension, and it's okay if while you do this, you start to lose the sense of being able to breathe into that part of your body. These are things that will come with practice. And a lot of people tell us that when they practice them more, they start to learn how to move with more ease, that movement feels better. And part of the reason that we want you to do this is because we know that when we can move with more ease, that it changes the physiology of our body in a way that will actually give us less pain. There are chemicals that get released in our body when we move in a way that doesn't cause much pain, that feels good. Those chemicals actually help to turn down the pain. They don't cover them up, they don't block them in a way that you'd be able to injure yourself because of it. They just, once again, make the intensity less. So you sort of end up with this right kind of snowball rolling, that the movement changes the chemistry that way, which gives you less pain, and that helps you be able to move a little bit more, and that helps you be able to get your body better in the end with less pain. So if you are still moving your legs, let them rest. We'll just try the opposite way. So once again, come back to longer, smoother, softer. Make your breath a bit longer. Make your breath a bit smoother. Make your breath a bit softer. This time you're going to extend your legs. So lift one foot up, bring the foot towards the front, put it back down on the ground. And the same thing the other side. And as soon as you've got this movement, come back to longer, smoother, softer breath, creating a sensation like you're breathing into your knees as you do this, or into the knee that's moving as you do this. You start to hold your breath, do your best to keep it flowing. If you do your best to do that, it still starts to hold, maybe try not to move so far. Idea is to start to become curious. How could you change this? Now your feet are back down on the floor. Let your body relax a bit. Maybe take a few bigger breaths now. Sort of feel myself wanting to do that. So you do it too. Just take a few bigger breaths. Breathe in. And then just let the breath slowly come out. Sometimes when people do this, they feel better when they get some sound to it. Just doing a sigh, like a it's up to you, whatever would feel better. Just try to do that and let go just a little bit. Then feel your feet on the floor. Feel your body sitting on the chair. Feel the length of your spine. If you can, find some softness around your face and your eyes and your jaw and your tongue. Find some softness around your shoulders. If your hands are tight, give them a little bit of shake and let them relax. If your toes and ankles feel tight, just move them around a little bit. And then just find a little bit of stillness for a moment. If it feels okay to close your eyes, then close your eyes or soften your gaze. Or focus on something in the room. And just keep your focus of your eyes there. And just check in now. Check in. How does your breath feel right now? There's no need to change it right now. You can let go of longer, smoother, softer if you're going back there. Now the thing to do is to notice what's happening in your breath right now. Then expand your awareness out and notice what's happening in your body right now. If things call out to you, notice those things that are calling out to you, then see if you can let go and look around. What's happening in the rest of your body? Then change your focus, this time to your mind. Notice the thoughts that are there right now. Try not to get too involved in thinking about those thoughts, just notice the ones that are there. This is where being curious and being an explorer can help. And then shift again, this time shift your attention to your emotions. Sometimes it helps to take your attention to your head when you do this. For some of us, it helps to take our attention to our heart and our chest. For some of us, it helps to take our attention to around our belly and notice whatever emotion's there right now. Then bring all of your attention back to your breath again. Feel the sensation of the air as it comes in. Feel the sensation of the air as it goes out. As with all these practices, what we hope you'll do is you'll practice them here, and then you'll practice them other times during your day. And then as you practice them more, you'll start to find that these techniques almost will invade the rest of your life. That you start to notice that you're noticing more, that you start to notice that when your body's getting tighter, your breath is getting tight, that you start to calm these things down. So the thing that I want to remind you at the end of this class and these classes is, if you practice this, you will get better at this. And for a lot of us, as we do more practice, this starts to change the pain. For some of you, you practiced it once and you may say, wow, when I do this, I can feel the changes that happen right now. And what I'd say to you is, if you got that much change in one practice, imagine how much change you'll get if you do this every single day for the next 4 to 6 weeks. For those of you who practiced it today and this sort of felt good or okay, and you didn't feel any positive change, the message I'd like to give to you is that these are skills. And when we're in the face of ongoing pain and stress and that physiological windup, it can take practice of this every day for many weeks before some of us start to feel any change whatsoever. So the message is, practice will help us with expertise. And each of these ideas of movement are there to help to decrease your pain, to help you to move with more ease, and to help you to live well again. Thanks for coming in today.
Thank you, Neil. That was a great session. Neil, we got a question in the chat, and I just wonder if we could take a minute and just answer that question, because I think it's probably relevant to a few people.
Right.
Someone commented that when they focus on their breath, and this was at the beginning of session when we were doing the breathing, she says, when I focus on my breath, I feel short of breath, like choked, and it's, provokes the real fear response. Is this normal?
Well, I guess the first thing I would say is it's absolutely within normal. There's lots of times that what we need to do is to start from a place of more calm. And so there are times, and I'm glad whoever asked this question, thank you for asking it. Because what we need to recognize is not everybody can do the same technique. And this is part of the reason why you hear me saying over and over again, if you need to pause, pause. If you need to shift around, do that. But it extends even further. And it's sometimes the best thing to do is for people, as an example, could be to start with more of a body awareness focus rather than a breath awareness focus. Or some people say is that if I do these awareness practices first, they create what this person has said, they create anxiety, they create fear. And sometimes when that happens, the best thing to do is for now, say, I'm not going to work on the awareness practices. What I want to work on is the regulation practices. So for some of us, it's better to start with, like we did in the last session, of learning how to let muscle tension go. So to regulate the body tension is the better way to start than body awareness. And for some of us with breath, it's better to start with finding breath practices where we are actually controlling the way we breathe, and that doing that in a way to sort of calm the physiology down. So the one last thing I want to say is that when a person has that kind of experience, often it takes we have to just try different breathing techniques. We have to look for the breath regulation technique that will serve that person. That it may be that some of the breath regulation techniques themselves can make the same kind of anxiety or fear reaction. And at times like this, that's why the best way to do these things is when someone has some expertise around pain and around these techniques and knows you individually. And in this case, I guess what I would suggest is maybe the best thing to do for that person would be to find someone who has some expertise in this, and maybe have a telehealth conversation with them to get them some guidance and to guide them through to find the right place to start.